Hello, everyone, and thank you for joining today's webinar, Making Resilience a Priority. As you get settled, please feel free to say hello and where you're joining from today in the chat box. To qualify for continuing education credit, AIA California provides learning objectives for every webinar and includes them in the PDF presentation that can be made available online. We will provide links in the chat box where you can find upcoming and on-demand climate action and ZNCD webinars from AIA California. A few quick housekeeping reminders. Today's session is being recorded and can be made available on the AIA California website, aiacalifornia.org. Today's session qualifies for one AIA HSW learning unit. For those who stay on and watch live, AIA California staff will report these units for you. Certificates of completion can be sent upon request. Please use the Q&A function to ask questions for today's presenters. You can also like a question to move it to the top of the queue. Finally, cultivate a positive learning environment. AIA California strongly encourages attendees to be constructive in their comments and questions to the presenters and to one another to foster a positive learning experience for everyone. I'd now like to introduce our moderator for today. Fred Marks, FAIA, is a visiting scholar and research collaborator at the Salk Institute for Biological Studies in La Jolla, California. Mr. Marks is a founding member and past president of the Academy of Neuroscience for Architecture, as well as an advisor to the International Arts and Mind Lab at Johns Hopkins University Medical Center. He is a past president of the AIA Palomar chapter in San Diego County, a current member of the AIA California Climate Action Education Subcommittee, and a current advisor to National ASHRAE for its Guidelines 10 document. Fred, thank you so much for being here today, and I'll hand it over to you.
Great. Thank you, Sarah, and good afternoon to everyone. If you've been following the news for the past several weeks, you will know there's been horrendous flooding in Texas, Brazil, and Germany, record heat in the Philippines, Thailand, Indonesia, and India. The US had its second highest number of tornadoes in April. And certainly California has had its own share of environmental extremes. Buildings have been damaged and destroyed. People have been displaced and lives have been lost. As architects, we have a responsibility to understand climate change and provide professional solutions towards mitigation. To help us understand our options, I've invited Adele Houghton, FAIA, and Ilya Azaroff, FAIA, to talk about resilience. Adele is president of BioSitu, LLC, where she works at the intersection of buildings, public health, and climate change. She earned her PhD at the Harvard T.H. Chan School of Public Health and is co-author of the book Architectural Epidemiology, which was published this year, that proposes a novel method using data to maximize a building's positive ripple effect on community and planetary health. Ilya is a geographer and internationally recognized leader in disaster mitigation, adaptation, regenerative design, and resilient planning strategies. He is a full tenured professor at New York City College of Technology, also known as SUNY, and a founding partner at Plus Lab Architect PLLC. He served as National AIA's representative to the United Nations Conference of the Parties, also known as COPE. Adele and Ilya, please begin.
Well, thank you, Fred. It's really great to be here. Let me get my screen up and share. And a wonderful introduction as well. I'm happy to be here today just to share some of my experiences and office experiences responding to disasters, adaptation mitigation, working in sustainability and resilience, not just in buildings, but with policy and training. I'm also happy to see that some of my, we have an office in Santa Monica, and I see some of the employees have joined in from there as well. So great to see everybody. Our office, as I said, kind of engages in these elements, and we work all across the world. I'm really committed to bringing more voices and hands to this essential work, so I'm glad that you're all on today. As Fred said, we play a distinct role as architects, and I'll get into that. Just a little bit of an agenda today. I'm going to take the first part of this and talk about the why, the issues that we face, talk a little bit about the COP experience and why architects were essential to changing the future of our planet. I'm going to pass it on to Adele to take on a piece about California and the context through a case study. And I'll wrap up with a resilience case study of how we bring this into practice and apply it to a project. So first and foremost, we have to talk about what Fred said. We're all in the same storm, and we need to understand the nature of the storm to be able to navigate it. We need to understand how enduring shocks and stresses from hurricanes and tornadoes, as well as tropical storms, flooding and drought, not just on the coastal areas, but all throughout the United States and around the world, have to be able to address resource stresses that arise from earthquakes across the world. With the loss of housing and infrastructure, as well as the loss of community, jobs, and livelihood. We're also seeing that the chronic events that are increasingly more common place millions of more people around the world at risk. California last year, with the atmospheric rivers and flooding, there were over 700 landslides and a great loss of life. So when we think about the Paris Agreement, we have agreed to 1.5 degrees. We've agreed to put 350 million more people in vulnerability. So this is the storm that we're in. Every minute of every day, 24 people are displaced around the world. From here in New York to there in California, it's a lot of folks. All across the world, last year alone, we topped 100 million people. In fact, 114 million people. The overall losses from worldwide natural catastrophes in 2023 alone totaled $234 billion, according to MDAT. That's an incredible, incredible amount of disruption. Global climate impacts and natural disasters are affecting all of our communities. I think we can agree that we are all in the same storm. And if we take a look at the IPCC report, something I want you to all get a hold of, it states and shows that over 3 billion people live in climate hotspots and are very vulnerable today. So that's over 3 billion people who could use the services of architects today to navigate this storm. The report confirms that the future global climate risks are shared across communities large and small. Heat, water scarcity, food security, increasing flood risk are among them. And as systems thinkers, as architects, we can truly recognize what cascading effects occur, how they affect people, places, and economy. Let's take this example of heat and the cascading effects that come along with it. It demonstrates that the local health, all the way to the global livelihoods, are affected across that supply chain. So those are the systems that we can recognize and need to understand in our projects. In fact, everyone in attendance today, you're going to see the impacts increase in your lifetime, the ones that are shown here that go well beyond what we're experiencing today. But we have time to change that narrative, to change the story of the future, build better communities if we engage in that today. And these are not just carbon neutral, these are ones that are resilient today and regenerative for the future. So let's talk a little bit about that. So in 2023, it showed us the number of natural disasters is on the rise. It's actually tripled for the next generation. That's the prediction. So think about that. The timeline I showed you, what you will see in your lifetime, your children and grandchildren will see by the end of the century, is tripling in the number of disasters. In fact, just the yearly economic loss from disasters has doubled in the last 30 years. That's incredible, incredible. As an example, the US last year had 28 events that exceeded $1 billion worth of damage. That was including the flooding in California with those 700 landslides that I mentioned. And this is not an anomaly. They are increasing every year across the entirety of the world and the United States. Our coastal communities are particularly vulnerable, as you can see here, with 39% of Americans living in these areas that generate 46% of the GDP. These are some of the most vulnerable areas that we have, but they're not the only places that are experiencing the shocks and stresses. So what does the future hold, right? If we think about 2050 or even go beyond, because remember, we're building for tomorrow. Whatever you build today is for tomorrow. Yes, you must address the impacts of today, but the buildings must last into many generations in the future. So by 2050, it's estimated that 200 million people will be displaced annually, and that by 2100, that number will go up to 550 million people. Unless we really work at this as architects, we need to build resilient communities that can adapt to a hotter, wetter world today. We have to work on that now, preparing for storms while reducing global warming for tomorrow. Now, something that is very important about the COP process that Fred mentioned is the Sustainable Development Goals. For 25, 30, 40 years, you've got nations committed to improving these qualities around the world. Architect-led adaptation touches many of the Sustainable Development Goals identified here, such as communities around the world. National commitments need to be met. And at going to COP, what we recognize is there's not a single country that is meeting its goals for the SDGs. So how do we see ourselves in this? Well, look, the AIA Framework for Design Excellence does a really good job at showing how architects impact each of the SDGs, okay? And so, I'm sharing these slides with you. I'm not going to go through each of these. However, your expertise meets what the world needs today. So I'll take you a little bit about the Conference of Parties. Many architects attending there, it is just something new over the past several years. And entering into the first COP a few years back, we were asked why we were there in sort of a surprise sense. And this last COP, this last year, there was a greeting of, oh, good, the architects are in the room. Because we're not spectators here. Folks recognize we have keys to the solution. We need to be active participants in solving the wicked problems in the world. And I'm hoping that you're going to help me do it. So just to backtrack to 2022, at COP27, here is the crux of where we're at today. The adaptation agenda was launched, committing to building climate resilience for 4 billion people worldwide by 2030. Now, that's a tall order, and that means a lot of architects. It's all hands on deck to make sure those communities, those 4 billion people, half the global population, is resilient and does not get displaced from shocks and stresses. To further support those goals this last year at COP28, recognizing that those shocks and stresses are the first thing that we must do, act immediately. There's been a shift in global financing from mitigation, which was all about carbon and GHG, all the way to adaptation, which is to stop the effects of climate and disasters. It was an increase from a 2% financing model to a 9% financing model, and that's moving very rapidly to now 11%, 12%. So soon you're going to have so much financing behind the to meet that global need. In fact, recognizing one of the other elements that came out of COP28 that's important for us to look at is health. And this is about health of environments, and Adele's going to go into that much further than I will. But how we look at the GEP, the gross ecosystem product, is now essential for us as we look at our projects. In fact, ecosystem services were evaluated globally at $33 trillion annually. Think about that. So as we look at our projects for sustainability and resilience, we have to look at the GEP as well. In fact, here's one of the publications I want you to take a look at, is the Global Center on Adaptation illustrates the financial need sector by sector. $500 billion will be needed in annual investment by 2050 just for the work that we do as architects. This is for buildings and retrofits. And that money is coming forward rapidly. There are many funds out there. If you're working in the global sense, great. If you're working here locally, we'll get into some of the things that are out there for you to get a hold of. Good news is that there's a lot of guidance on this. Just last month, this was released on climate resilience. It's a new way of looking at investing in the work that we're aimed to do for those 4 billion people. And by investing, we're investing in marginalized groups and frontline groups to create equity and justice through the work that we are doing as architects. Supporting the wider benefits of adaptation has been proven that better communities decrease poverty. They promote healthy communities, reduce inequity, and promote life on land and water if we are looking at sustainability in a regenerative process. So ultimately, coming out of COP and looking at our framework for design excellence, we need to have the ethos that sustainability and resilience are two sides of the same coin. Our projects must embrace both of those things to produce true equity. Okay, so keep that in mind as I roll forward, because if you think about the sustainability side, we're all very familiar with the 2030 challenge, mitigation. And we've been doing a very good job at moving that forward. We're adopting, and a lot of folks are really working on that in their practices. However, we have not been, as an industry, looking very much at this 2030 challenge. This is the Sendai Agreement. This is the DRR, or Disaster Risk Reduction Challenge, that by 2030, we are making communities safe around the world by implementing adaptation. So this framework has been around since 2013. And it's something that now, as architects, we need to understand the second side of that coin. So ultimately, that COP summary, here's what you need to have as a takeaway, right before I pass this on to Adele. Architects, we are at the pinch point, right there in the middle, to translate community needs and goals, to unlock global financing that is available for adaptation and mitigation, and it is in the hundreds of billions of dollars. You also, in so doing, must include biodiversity and ecosystem services in your projects for unlocking that funding, okay? So more on that when I come back and tell you about the project that you apply this to. So let me stop sharing. I'm going to pass this on to Adele. Adele, take it away.
Great, thank you. Can you all hear me? You can? Okay, great. I'm having some technical difficulties, so I have switched over to my phone, and I'm not going to show my video, but I'm hoping that the slides will work. So please jump in if they stop working for whatever reason. Thanks so much. What a pleasure to be a part of this group. And Ilya did such an incredible job of framing the topic and why it's important, and kind of where architects fit in at the international and national scale. And so what I thought I would do is bring us down to the scale of California and specifically talk about how we as architects can understand where our projects are located, and in a more holistic way, take a look at the larger systems within which they're going to be functioning, whether they're environmental, social, or related to human health, and how we can make use of all that information to design resilient projects for any kind of event that is coming our way, and being really strategic about it. So I'm going to do that by looking specifically, as an example, at the cascading climate change related events that happened in Southern California from about 2012 to 2018. And I'm going to kind of frame this from a public health perspective. As Fred said, I work both in architecture, green, healthy building, as well as on the health effects of climate change from a public health framework. And in public health, the way that we approach climate change is first by understanding the hazards, which in this case was the first of these events was a drought. And then we look at what were the actual exposures, or what could the exposures be related to that hazard. And then we link them over to health outcomes and what would be the increased risk for those outcomes. So if we think about those of you who are from Southern California, think back to 2012 to 2016, that there was this incredible drought. And a lot of vegetation was died over that period of time. And so you ended up with a situation where you had really low water levels and concerns about air pollution from the dust, as well as the amount of water reduces, the water is evaporating, but the pollutants that are in the water don't go anywhere. And so you end up seeing increased concentrations of pollutants in water, as well as in warm months, the water warms up and it makes it easier for pathogens like bacteria or harmful algal blooms, things like that, to grow. And so what you end up with are kind of two major exposures, the pollution and the water quantity and quality. And so what you can see here is with outdoor air pollution, the direct health effects tend to be depending on the size of the particulate matter and what's in that particulate matter, exacerbating respiratory disease like asthma, cardiovascular disease, and potentially increasing the risk of cancer. Indoor air pollution is connected because all of the air that we drink or that we breathe indoors started outdoors. And so what we actually see is that in many places that even with filtration, you still see an increased exposure to pollutants that are outdoors. You actually experience a higher concentration of them indoors. And so you see those same exact health exposures leading to increased in risk of health outcomes. With the water quantity and quality, again, depending on what the pollutants are or types of pathogens in the water, you could see an increased risk in cancer, an uptick in waterborne disease. And then if that polluted water gets into the irrigation supply, it can lead to food recalls, and that can reduce the availability and reasonable cost of fresh and healthy foods, which can increase the risk of obesity, diabetes, and hypertension. And so I guess the other kind of main indirect health outcome from these a major drought like this is mental health. And you'll see mental health kind of repeat on the coming slides. You can see mental health both as something that could be exacerbated or triggered by the fact that you're already experiencing these crises. And also there are certain types of particulate matter can actually exacerbate mental health conditions, certain conditions directly, or they can also interfere with medication. So that's something that you're going to see repeat. When we then move on to the second crisis that happened in this period of time, after that huge drought, we finally got some rain, but that rain, just like we've been seeing from the climate models, was really intense, and it was at the wrong period of time of year, and it ended up creating a lot of flooding. And so the direct health exposures are, flooding, obviously, and then we also have a problem with water quality because when that kind of flooding occurs, it actually picks up nutrients in the soil, fertilizers, oil from roads, and actually causes pollution in the water that humans can come in contact with. So the direct health outcomes associated with the flood, obviously, you can, be injured or killed during a flood. You can drown. That's a direct health outcome. And then many times after these floods, actually mold starts growing very quickly. And so indoor air pollution related to mold can then lead to same, issues that we had before: respiratory, cardiovascular, and cancer. We also see a bloom of disease carrying vectors like mosquitoes and ticks after this type of flood. And those can lead to, vector-borne diseases like dengue or West Nile virus or Lyme disease. And then you see the same types of direct and indirect health outcomes associated with that poor quality water. So then what happens? We had a hot, dry summer. All of that brush and grass that grew turned into fuel for wildfires, and we had this incredible, horrible wildfire. Okay, well, so exposures to wildfire. Again, direct exposure to wildfire is not good for your health. You could be injured, you could die. And then also, I think what most of us in the US think of in terms of the health effects of wildfires, it particularly is happening a lot in the news right now, is the particulate matter and the haze, and kind of the, depending on what actually burned, it can actually be quite polluted, that air. And so you could, again, be exposed to that directly outdoors or also through the indoor air pollution. And then finally, again, mental health mental health conditions could be triggered in lots of ways, both directly from this crisis. Keep in mind that now we're on the final of this cascade. The mental health issues related to these crises has just been amplifying every time. And I just showed the exact same exposures and health outcomes for the previous flood for this last rain event. The difference is that the wildfire had actually burned away most of the land cover for some of these kind of mountainous areas around kind of coastal towns in Southern California. And so we ended up both with a major flood as well as mudslides and debris flows. And so that just amplified those, particularly those direct health impacts of flooding, injury, and death. So when we think about it, everybody in Southern California was kind of exposed to all of those events and probably experienced some level of some type of health outcome associated with them. But what we know from epidemiology is that that these types of health outcomes are not distributed equally across the population. And so this slide is showing you a great infographic from the Bay Area Regional Health Equities Initiative that visualizes what we call the social determinants of health, which basically kind of categorizes different groups of people who have a tendency to be more vulnerable to poor health outcomes when they're exposed to things like drought, flooding, and wildfire because of different reasons, right? So if you look on the left, we've got social inequities. So we have social and political decisions that have been made over time, either due to racist policies or just due to more kind of financially related policies that kind of allow for lower income neighborhoods to be located in places that are more prone to, say, being the first place that, say, a landslide is going to hit, or the first place that's going to lose access to fresh drinking water during a drought. And so those groups of people are at higher risk simply because of where they live, where they work. The living conditions in the middle, I think, is particularly important for us as architects because we're the ones who maybe we don't make those decisions, but we are at the table and we can be strategic about the way that we encourage our clients and the way we advocate to our local and state and federal government to say, you know, it's really important that we incorporate certain safeguards into the design and the maintenance of buildings and land use so that they are protecting particularly those groups of people who are either most exposed or most vulnerable due to their physical condition. And that's one of these boxes over here on the right. Disease and injury is really kind of looking at that third group of people who are maybe very young or very old for some physiological reason. If they come in contact with, say, an extreme heat event or a pathogen in the water, they're much more likely to end up sick than if an able-bodied, adult who has a safe place to stay and a job that will allow them to pay for healthcare. That kind of group of people is sort of seen as sort of like the average, but they're in fact maybe the most resilient in terms of when they're exposed to these types of triggering events. So what do we do with all of this information? You all have a lot of information that you can gather about the sites where you are working that will allow you to bring in additional data sets than you probably use right now. You can look at federal data sets that I think Ilya might talk about in a bit. These are local ones that you all have that are California specific that will help you understand both the natural and built environment vulnerabilities to different climate change related events, as well as social vulnerabilities, environmental justice questions. I think the question that people come to me about a lot of the time is they say, okay, I get it. Like, we're not going to build, if in that scenario we just talked about, we're not going to build one building to withstand the wildfire and a second building to withstand the mudslide, right? Like, how am I supposed to incorporate this into my design? And I'm going to walk through a case study of how you can do that in a second. But I first just wanted to share, and we're going to put into the chat all the links to these funding opportunities, which are above and beyond what you also have access to through the federal government right now. So there's a lot of opportunity in California, both in terms of understanding your site and its neighborhood and how what you're doing could actually make a difference. And also there's funding available to pay for it. So I'm going to close by sharing with you a very brief kind of overview of a process that I've developed called the alignment process that comes out of what Fred talked about, this book that I've been working on called Architectural Epidemiology. It takes that as kind of a framework for understanding how do we take a look around our site and understand who's living there, what are their health conditions, how does the environment actually affect and amplify or stand in the way of potential vulnerabilities, and then what can we do as architects to make a difference. The alignment process takes that kind of framework and makes it very kind of step-by-step approach that any architecture firm or project team could use to on a project. And basically what it does is it takes neighborhood scale or census tract data. I use federal data usually, but in California you can use your California specific data, and you identify the aspects of the neighborhood that could be improved using the building design itself. We then take those metrics and rank them based on how prevalent or how different that neighborhood is compared to, say, the average in California or the US, and say, okay, well, these are certain conditions within the neighborhood that are kind of off the charts. And so we really want to focus our design on those topics. And then we ground truth it with stakeholders and change our recommendations based on what they say, based on their lived experience. So the case study that I'd like to share with you is a medical office building that's located in Northern California. And thinking back to that social determinants of health diagram, the social determinants of health that sort of popped up in our data analysis were housing insecurity, because there was a large unhoused population in that neighborhood that was going to be served by the medical office building. There's also a lot of income disparity in that neighborhood and in the city, which is pretty common in Northern California. And it also had a kind of an interesting demographic in terms of a very high percentage of Asian American, very low percentage of African American. So we were kind of sensitive to that fact and thinking through, like, how could we incorporate that information into the project itself. In terms of the community health indicators, the one that really kind of stood out was the fact that this site was located kind of surrounded by a lot of traffic and a lot of big streets. And that it also was identified by the city as being really high risk for bike and pedestrian safety. And so that was something that we could potentially try to start addressing to make it a safer and easier to go through that particular property instead of being exposed to the traffic alongside it. And then finally, you can see here that there are a lot of climate change and health vulnerabilities associated with this site. As I said, there was a lot of air pollution because of the traffic. Obviously, it's in California, so it's in an earthquake zone, which isn't technically a climate change issue, but it is a disaster question. And then the fact that it was there was so much pavement exacerbated flooding and heat risk. And then finally, this kind of as a weird sort of cohabitation was all this concrete and then also this kind of colony of mosquitoes that were infected with West Nile virus. And so thinking about how you could design the site so that you could address both of those topics. This is the kind of short list of environmental health priorities that we came up with based on reviewing the data and looking at those indicators and seeing how they amplify each other or are related to each other, so that we could focus in on the few things that would make the biggest difference with our design. And then finally, I'm going to end on this slide. This is sort of the slide that everybody on this webinar, I imagine, is most familiar with. These are all design strategies that are drawn from LEED, WELL, FitWell, Living Building Challenge, all of those rating systems. That's where we usually start our conversation when we're considering how we're going to create a project. We often think, oh, the more we put in, the more environmental and health benefits we're going to have. But I hope that I've shown you by mapping it out and really understanding your context and how what you're doing is going to fit into a larger system, that in fact more is not always better. Being strategic is where we want to go with that. So I'm going to hand it over to Ilya again to continue.
Great, thanks, Adele. That was wonderful. It was great to see. So let me bring you back to the presentation. Does everybody see that? Okay. So listen, now that we've gone through a couple of pieces, I'm going to take you through applying how do you get resilience in a project. And so navigating the storm. This is where our story begins, and I'm going to take you to the island of Oahu and to the Ko'olaloa Community Resilience Hub that we are now in our 4th year of working with this community. And to really take a look at this, your process for any resilient project or applying resilience into the project, keep in mind resilience and sustainability, 2 sides of the same coin. But to get to the resilience, you have to assess the hazards that are present. And Adele gave you a good sampling of there's some hazards that are coming through based on data, right? You have to look at it not just for today, but for tomorrow, projecting forward 50 to 100 years. Analyze the site, something you do all the time, but with the lens of what are the shocks and stresses and what are the assets of the site to help me. Plan with the community, that community engagement piece, align with government funding and programs, design the site and the building, and then of course, build the project. So in other words, be ready for anything. And one of the federal sort of tools that are out there for you, this is the National Risk Index. It contains information for all hazards, annual loss, social vulnerability, some community resilient assets that are there. And when you dial into your project or area or county, it creates a report for you. So it gives you a basis of information and great research to build off of, right? You can also project forward with this information. So it's a great place to start. So we started with that in mind when we came to this project. The next thing is aligning and assessing using state and local hazard mitigation plans or other documents that are out there, university studies, whatever they might be. The hazard mitigation plan is important because it is an adopted document and it is tied to federal funding after disasters, as well as mitigation dollars. So we identified all of the hazards for this project in Oahu there, the different types of events. Then we use that as our identified hazards, and we bring those to the community engagement, right? Then through that engagement, we can understand the effects of that climate hazard to your project and the people that are there. It'll have the cascading effects to the secondary effect. What happens to the community members here and their businesses, the short-term and the long-term effects that will happen based on the different type of hazards. So this diagram isn't important. It's this process that we go through. But to understand, similar to what Adele showed you, is here are the hazards, here are the effects of those hazards, and then you start to build an understanding of what the performance of your project is going to be. Back to the federal side, aligning with the 7 community lifelines to organize the community assessment is rather important. Again, you're still aligning because a lot of the funding and the language you're going to use in this process are really important. We look at the safety and security, the roof water, the food, water, and shelter, health and medical, energy, communication, transportation, and hazardous materials. Those are your 7 community lifelines that FEMA has identified, and they're going to be splitting off water into its own lifeline because of the importance of it. So keep these in mind as we roll forward. I did mention as you're doing this, you're going to be projecting forward in time. That is really essential. So when you're looking at what requirements there are, look at those as minimum requirements from whatever code cycle you're in to understand here is the climate change model for extreme heat. Here's the climate change model for rain, precipitation, all the actuarial science and information for the shocks and stresses that the building may experience during its life cycle. We use the 7-generation model in our project because we work with a lot of native communities and indigenous people. So here's the site analysis. So going from that kind of assessment and understanding this global picture of some of the things there and the elements that are available already, we then begin to look at the site. Now, keep in mind that your site analysis probably goes beyond the geography you're thinking of. Think big to your geography, where the flow of water is coming from, all of those things. In this case, we started to look at the time frame for tsunamis because of where it's located. And as we rolled forward for the site analysis, we then did our modeling of all of the hazards for high wind, hurricanes, and the location of the site. You can see the small green rectangle there. That's our site. And there is all the flood inundation that takes place category 1 through 4. I didn't put 5 on here, but it really begins to show us we've selected a good site, removing that hazard, at least for where our site is. However, the effects of that are on transportation as well as calculating the load of people that will be coming to our site as a resilience hub or a shelter. We also took a look at, the FEMA flood maps, how out of date or up to date they are to really understand how we begin to do other modeling for the project in the area. Another piece going back to that first site analysis of the tsunamis, we looked at the extreme tsunami zones that are part of the North Shore. And you can see our site there. The red is the tsunami zone, so it's a higher percentage. The yellow is the extreme tsunami zone, which projects into the future or for a very extreme event, highly unlikely. Our project is located in that zone with a part of the site, the highest elevation of the site, out of that zone. Very important for us to understand. We also understand that the transportation vulnerabilities for the site analysis, there's one road in and one road out for 26,000 residents in the Ko-Ololoa region. And that means that, and they fail almost more than once annually. So you can see there in the inset picture. So that vulnerability is real. And what that means is this site and the people, if hit by a heavy storm or a shock or a stress, are isolated for 30 days. 30 days, no power. 30 days, no in and out, no help from the outside. That's very important information. For the site itself, we look at topography. We get LiDAR data looking at water flow. We catalog invasive species, bring on archaeologists to record that data to really understand what the nature of the site is and what we can do going forward. Sorry, it's changing. There it is. So I'm just going to give you a snapshot of the site. This is a 5-acre site. This is an initial site plan. I'll come back to it later. But the main resilience hub you can see noted there, and there's a red dashed line across there. That is the actual extreme tsunami zone line. We needed to identify it so we understood how our project may work with that and remove that hazard. And I'll show you how we get there. On to the community engagement. So planning with the community, the first thing that was said to us, my community is self-aware, self-actualized, and invisible. Invisible to the government, invisible that our plans cannot be translated, as I mentioned, the pinch point. The translation to unlock funding, unlock the realization that we are a community in need and need to have this addressed. We worked with the community to understand what the team is. So the community itself, the residents identified whole populations of homeless people that were part of our engagement, whole populations of Native Hawaiians who live off the grid currently. And then we looked at, development design teams, landowners, surrounding businesses, institutions, government, similar to the process you do, but then think about the expansion of that. We brought on ecologists, native medicine specialists, horticulturalists, cultural historians, reef restoration specialists, archaeologists, all kinds of folks that needed to be part of our engagement and team. Ultimately, with the community, we're identifying mission critical functions for the town of Hauula. And we've identified one especially important thing, which is cultural erosion. We also had seen that food insecurity is an issue. They're in the middle of 80 farms, yet the locals cannot afford the food that is grown right around them. So that's an economic issue. So if resilience is action, how do we make the food accessible, affordable, and how do we create jobs to increase the economy, a circular economy of place? Energy security is an issue. In blue skies, energy fails here in these coastal towns, under blue skies, constantly. We also gleaned from the studies that 85% of the homes will be damaged in a Category 1 hurricane, meaning that we already know the load of people and the vulnerability of the housing that we must address through this project and design. Coastal erosion is something that's said about the fragility. This was a king tide that we were there for a site visit. King tide washed out the whole road. Full moon, king tide washes out the road and makes part of it impassable. And there's one road in, one road out. It is really a tenuous lifeline. So why I'm bringing you back to the lifelines, when you go through that process and you look at the community engagement through those lifelines, what it does, it starts to align potential funding. So the funding available for our project comes through the IRA, as well as the EPA funding that's out there now. It's a lot of funding. I'll put links to it. Money and funding from Homeland Security, from FEMA, and from HUD. And there are many other ones from not-for-profits as well as those that support Indigenous groups. So aligning the hazards to what we need to do in the project are listed here. There are elements that are much more prescient to the population that we address than you'll see in the design, and others that are more tertiary, but yet we recognize them and have a plan for them and understand they must be part of our design process. Further aligning, we found that you have a local resilience or a resilient planning strategy. Part of Rockefeller 100 Resilient Cities, they produced the OLA plan, and resilience hubs are listed, and this specific community is listed. So getting the government to align to a project and help fund it is an easier lift if you understand how to align with those government processes. So again, on to the community workshops. We brought in all those stakeholders that I mentioned to make sure that they were part of this process over a 2+ week period in our initial visit. Over 100 participants locally, along with the split into 8 working groups. The priorities that are identified, you can see some here listed. They started to talk about, family, security, safety, health concerns, a self-sustained center so they don't have to suffer through the shocks and stresses of their vulnerable housing. They also wanted to make sure social benefits are taken care of for the elderly in all generations. Job training, vocational training, all kinds of things that came forward as part of what a resilient community looks like through those lifelines. And then this idea of a holistic design really is based, at least in this community, mining indigenous wisdom, getting local knowledge. Doesn't matter where your project is, getting the local knowledge is essential for success. There is historic elements that maybe have been chronic issues that don't come to the table without this, and you truly need the folks that understand that there is a history to these things that can inform the future. So here's a couple of quotes from the community. This community has not had a voice. We have not been visible. The community engagement, getting together, talking, sharing, laughing, hurting together, whatever it is, builds bonds in the community. So they're talking about social resilience. And this is some of the youth that participated in our workshops. When we talk about sustainability and sustain our life, I believe helping sustain our culture. Culture began to become one of the major things that was being eroded. And here's the last one from Ronnie there on the left. We may be poor, but we are rich in our culture. That is why we still hang on here, why we still do what we do. We fight for the next generation so we don't forget the culture. They don't forget where they're from and all of their roots. So some of the other things that came out of there to highlight that, what was necessary for a community resilience hub was to address those elements, but the community wanted the hub to be an oasis of well-being. The goal of re-envisioning the relationship of the place to people and culture. It's a very Hawaiian cultural element, but we took that on in this project. And 2 ideas came forward. One that was the land use, and the other one about the building. For the building, it's the va'a, what you see there on the left, and the ahupua'a, which is the land use on the right, because the project is located in the active restoration of an ancient Hawaiian apuhua'a. Sorry about that. And you can see that location illustrated here. Some of the other elements that we grabbed a hold of are the local materials, the dry stacked walls and terracing that shapes and harvests water from the site, from the up valley forest area to help green the site, as well as replant native varieties as part of the aspect of this project. The plants for food production are integrated into the 5-acre site, as well as propagation for the surrounding community. The natural water mitigation takes care of the heavy flooding that often occurs in and around these neighborhoods, and the site is becoming a sponge. The site also uses its own wastewater as part of the management through the land and the plantings. We're looking at the Living Building Challenge as well as Living Community Challenge. Oh, and by the way, that funding was done through the EPA to do some of this work. Now, fire hazard is one of the things that is on everyone's mind after the Maui fires or the Lahaina fires. And so we took a look at that and got the communities to really understand we've already designed for that hazard with xeriscaping and defensible space all around the site, which brings us now to the building. So the building, the va'a. So in talking with Dr. Tusi, one of the elders, the kapuna of the village, he told us about the ancient mariners, the Polynesian mariners would flounder their canoe in open ocean so they wouldn't lose the stars as a storm came over. Didn't matter if it was a hurricane, whatever it was. But we started to research what would happen when you came to an island you didn't know and a storm approached. We found that the Polynesian travelers would huli or flip the va'a over and take shelter underneath from flying debris and high winds. So it made a lot of sense to begin to look at this as a historic cultural aspect. And what we've come to is the main building is the Ko'ololoa Community Resilience Hub, which you huli the va'a, that takes into the cultural elements, and it also looks like a hale, a traditional hale for Hawaiian gatherings. And the community has embraced this design. The design, though, also has high performance. All of those things that we mentioned at the beginning of the analysis, this is a FEMA 361 near absolute protection community shelter. All the hazards are addressed that I listed. It has 30 days of off-grid capability for 1,500 people and meets all 7 of the community lifelines. This diagram shows the section of how it embraces the upper portion of the land and is elevated above the extreme tsunami zone limits. And this is also going after a FEMA BRIC grant, or has received a FEMA BRIC grant, technical assistance grant. So we've been working with folks about how and we can get this to the highest degree of protection to shocks and stresses from climatic impacts. One of the latest people to join us is to our team is this master carver. This is Tuoni. He is considered the master carver of all Polynesian people, 17 countries. And he happens to live in Hauula. He has dedicated himself to this project, and he is going to be opening a carving school to help regenerate the cultural aspects and not lose this craftsmanship of the Polynesian people, but he'll also be assisting in carving some of the interior spaces and putting on display and bringing forward that next generation of folks. But not to be outdone, we also have an ETIP Department of Energy grant. So through this, we took all of the renewable 30 days off grid, and they have been working with us for well over a year now, and we've run 4 different models. These 4 different models were in concert with HECO, which is the local energy consortium, to get to this place where we have 30 days of off grid, and this building is profitable to the community. It will after maintenance as well as after maintenance and all the use, this has a profitability of selling energy back to the grid on a monthly basis. And what you see here is part of the 7,200 scenarios that were run through our models for fitness of the project based on resilience, environmental, and financing to make sure we can actually design and build this properly to meet those challenges. So ultimately, we're wrapping up this entire presentation. And the goal of this project is to look at the 4 R's. When you go through the assessment and the site and the community engagement and begin your design process, you have to have in place that we're always in a state of becoming, meaning that this is not a static project. The robustness is intense about before the event. During the event, how does the building perform and operate? And then after the event, how does it help recover or recover the entire surrounding community? From that, the occupants have the lessons learned to bring that back into the operations and maintenance of the building. So where we're at today, just the final couple of minutes here, is that we've been clearing the site. It's actually been cleared. All the invasive species have been taken out with help with the EPA. We're planting new native varieties. Team Rubicon has come and joined us. There's volunteer organizations to finalize the taking out of all the invasive species. There were only 4 trees, by the way, on the site that were native species, and we've held on to those, and we're going to keep moving. Currently, a walking path has been developed for the community use. The initial phases for the community starts to embrace this. There's farmers markets on the weekend, festivals for the community. And then the other progress is early March, we received funding from a federal earmark. So aligning all of those elements from the federal side paid off because Senator Schatz from Hawaii secured $5.4 million for horizontal construction, and he will be moving this along for next year as well to start the next phase. So ultimately, the residents feel the 2 sides of the same coin coming together. We're starting to regenerate the site, and the community and its cultural practices are not just being respected, they're being regenerated through this process. Lastly, here are the resources that we posted. First and foremost, you can find there's a great resilience design toolkit out by the AIA, resilience or the Framework for Design Excellence as well. And from the federal side, here are your partners. Every agency was ordered to put together a federal climate adaptation plan. Architects are needed. It doesn't matter what sector you work in. If you're working in security, you're working in healthcare and human services, urban development, there's funding there. You just have to know where to look for it and start to unlock it for your projects. And then, of course, National Institute of Building Sciences. I saw something in the chat about how do you really start to convince clients of this? Well, it's every dollar spent, you save $8 on the back end. If it's a business, it's even more, because that's just the physical losses. That's not even the business loss. So continuous operations is a way to go, depending on where it is. So take a look at that document. And with that, I'm going to say exactly what Fred said. Look, the answer lies with us. Architects have an essential role to play in this, and we're in the greatest market transformation that's equal to the greatest climate impact issues that we face. And we have the answers to really unlock that for communities to be safe and resilient. Thank you very much. I think that's it, Fred.
Yeah. All right, my video is not started. So if everyone can hear, oh, there we go, good. Well, thanks both to Ilya as well as Adele, and I know we're running short on time. Ilya had addressed one of the major questions that I see in the Q&A, and that is, you know, how do you get the community to understand what their options are, not to mention to change their mind about what they had been originally planning. And I think one needs to go back to data and to explain, certainly on a worldwide scale, how it has affected certain communities and how it may eventually impact the very clients that you're working with within your locale. There was an interesting question about.
Sorry, could I jump in real fast?
Yes,
Sorry,
please.
I'm here. I'm just, my computer's acting up.
Okay.
So the alignment process that I put the link in the chat, one of the things that we did that was really important was after compiling the data was we actually worked separately with each stakeholder group to understand what their motivations were and how they viewed the neighborhood and the contribution that the project could bring to that neighborhood. And then we brought them all together to align around a common vision for the project. And what we found by using that kind of two-step approach to community engagement was that we were able to introduce design strategies that have kind of a tendency to be viewed by particularly people, at least in the US, who are kind of in low-income neighborhoods, as being too expensive. But we were able to kind of introduce them as these are things that are going to help, say, your house not flood anymore, right? As opposed to these are things that are going to help the city meet its climate goals. And so that to answer the question was sort of learning what each group's motivations were, and then being transparent about the fact that we were using the same design strategies intentionally to address different goals by, of different stakeholder groups.
Good, thank you, Adele. Another question had to do with ASHRAE and the guidelines that it provides for indoor air quality, that possibly they are not advancing as quickly as they should to understand how the world is changing. And as a member of several technical committees, I'll at least comment that there is discussion constantly about modifying what are the recommendations, not only used in the United States, but worldwide. And ASHRAE is a research motivated organization, much beyond what the AIA does. It's constantly looking at new research to advance its knowledge. So I think changes will be coming in the future, and part of its most recent initiative is to consider health where it had not necessarily been emphasized in the past. There was a question about what, and this is both to Ilya and Adele, what setbacks or pushbacks have you gotten from the clientele that you've worked with that you would like to share today?
Well, I'll give you one example. So people act out of fear and love, right? So most of the pushback we get is from governing bodies who have never seen the type of work we're trying to do because they don't have a touchstone or an example to say, we will fund that because we know it's successful. You're always breaking new ground in resilience currently and showing somebody a resilient house. Wow, I've never seen that before, convincing the client. So it's that fear of the unknown. So what you have to do is really play on the other side of it. The health, safety, and welfare and love of what your end goal is has to be demonstrated through the science, projecting forward, the risk that folks take, and that complete understanding. So the hurdles that we often face is really the governing bodies and trying to explain to them that this is a better solution and to unlock that funding. That's a major, major, major hurdle. There are many more, but I think that's the big one that comes forward. Thanks.
Adele, have you faced the same thing? And, where are the pushbacks?
Sure. Yeah, so I do think that so we've now performed the full alignment process on 3 projects, and definitely the local officials were all 3 groups did respond to our survey to say that they found more value coming out of this project than a typical project. But the local officials were the ones who maybe were the most skeptical. So I definitely agree about that. I'll say that from the development team side, there's a concern about lead time. And I think there's also kind of a fear of working with the community, just to say the elephant out there in the room. So the kind of working with the community within a framework of data, we found to be a way of overcoming that concern and saying, look, we're talking about this within a framework that is going to actually reduce your risk because it helps. One of the things we discovered really early on was that everybody comes to those types of community meetings with some sort of like 1 or 2 things that they really care about. But because of the way that we display the data as sort of this system of influences that interact with each other, it opened up a conversation where the person who cared about air pollution and the person who cared about, net zero buildings were able to kind of see how their concerns overlapped. And I say that across stakeholder groups as well. So those are 2 things. I think the last thing I'd say that I found to be a challenge in selling this idea to our own industry has been this question of, it's just too much. It's overwhelming. There are too many different, health effects. There are too many different climate hazards. So we're just going to pick one. And the reason why I showed that cascading example was just like somebody said in the chat. Yeah, in Southern California, they've got this cycle. But when we're designing things, we tend to focus on one thing that we just kind of decide is going to be the thing that we focus on for our design. And so bringing together the data in a way that is understandable and leads to a prioritization, I think can help overcome that concern of just sort of like, it's too much information, it's too complicated.
That's good, Adele. And I do want to pick up on one thing you mentioned. So after Hurricane Harvey, I went to work in the city of Houston and brought over all the stakeholders. There was the community that had me come there to do the work, and the AIA were a little afraid to bring in big oil. And I'm like, no, you bring all stakeholders. And what happened is big oil, which are part of some of our climate issues, they were so interested that their families and people that worked for them were safe. You found such common allies. And how do we make the city safe? Transportation, housing, everything. And they became the biggest ally in creating a resilient city. So you can find allies that were not allies, or you think they're on opposite ends of the spectrum, but they will find commonality in that one thing, a better community. Thanks, Fred.
Okay. Maybe time for one final item, and it has to do with AIA code. The question had to do with sea level rise, the fact that we are learning from scientists, what the projections are, and certainly we have current observations. Code can play a part, and it goes back to what you've been saying through the entire program, and that is be strategic, provide data, and bring the community in. And certainly don't talk over them, but to have them understand what are the consequences both in terms of their own lives and those who they share communities with. And if Sarah believes that we've run out of time, we can end here, or we can continue with additional discussion.
I think we're 5 minutes over, so I think we can go ahead and wrap up the program today. Thank you for all the folks that have stayed and lingered on. And thank you so much to Ilya and Adele for your guys' fantastic, super informative presentation. Already getting so much positive feedback and requests for resources in the chat. So no worries to all the attendees. The slides and resources and links will be made available on the AIA California website. It'll be the webinar page for today's program. Thank you guys again very much for your presentation. And we hope to see you guys at another AIA California program. So thank you so much. Thank you
Okay.
guys very much.
All right,
Thanks, Fred. Thanks, Sarah.
Thank you.
Thanks.
as well.
Yeah, thanks, everybody.
All right. And thank you for joining us today.